So the hospice house is a place where when our patients are having significant distress, either pain, shortness of breath, agitation, to where we can manage their symptoms, essentially try to help any way that we can.
The teams that I work with are very caring, very giving, and do whatever they need to do to make sure that our patients and our staff are comfortable and that are well supported.
Here in the hospice house, I'm able to devote my time and spend more time with patients and their families, and that's really rewarding to me.
I've seen how comforted my mother was, how wonderful the nurses are. Everybody really cares about how the patient is, but not only the patient, the family.
We are not judgmental here at all, so it gives the families a safe place to land. So then they tell you all their fears, their concerns. You're able to help and assist them without being judgmental.
I would say the hospice house is unique because it is similar to a hospital, but yet homey at the same time, where we're able to provide that same level of care as in a hospital, but yet try to keep it as home-like as possible. We have a lot of family members that never leave the bedside. We allow pets. In the last week, I think we've had at least 3 dogs. We had a cat last month.
We want this experience to be as pleasant as possible. So I was always brought up, you treat people the way you want to be treated. And that's what we do here. We act like these are our loved ones.
You feel like you're walking into a house. Everybody is, hi, how you doing? What can we do to make you more comfortable? What can we do to make your loved one more comfortable? They relax you, make you know that they care.
We have respite care. A patient will come in for 5 nights, 6 days. They're considered respite care, which means they don't have an ongoing symptom that we have to manage. So they're here just to give the caregiver a break, as it were. It gives them an opportunity, again, to not have to care about them and not, do the work. We'll do the work. You can just be here with them.
Unlike being in the hospital, I'm typically only seeing 10 to 15 patients a day, so I can devote my whole time to your loved one, to you, to try to help build that connection that we're there for them and no matter what happens.
I think it's being able to support the patients and also their loved ones as they go through this transition. Because for me, it heals my soul. To be able to sit with the family and to listen to their stories. If there is a husband in the bed and the wife is sitting by the bed, or vice versa, I always ask them what their love story is. And something magical happens. As they start talking about how they met, they light up like a Christmas tree. There are stories that we tell, that we share with others, that keep our loved ones alive.
They have volunteers come in and they will talk to them about things that you say was in their past, like my mother was a nurse. They'd have somebody come in and talk about being a nurse and taking care of patients and stuff and try to bring some of that back.
I say to everybody here, what you give me, I take a piece of, and then I give the rest to somebody else. Because as alone as we all feel, at this level, we're all able to connect. Even again, people that I've never met before, that when their loved one comes in here, we all become family with them.
I have a necklace that I'm wearing that's my mother's thumbprint. I have one and my sister has one that we now can remember her by. We're going to get 2 teddy bears that a volunteer is going to make for us as a memorial.
We're able to record a patient's heartbeat and then have it transferred to a mechanism that goes into a stuffed bear. And this way they always have the heartbeat.
I don't know how to put that into words, how special that is. Hospice House helped dementia patients, and my mother was one, with different therapies. They had the oldies country music in the 40s and 50s, which I couldn't find. They were starting aromatherapy too. You could get her to calm down with orange or citrus, but I wouldn't have known that. I wouldn't have been able to take care of her for as long as we did. Everybody has to know how wonderful hospice is, because when you're a relaxed caregiver, you pass that on to your loved one. They know that they're in a safe place. They know that they're going to be taken care of.
All of our staff that especially works here in the hospice house have that passion that's needed to be there for the patients and their families. It is very difficult seeing patients and their families suffering, and we're here for the patients and we're here for their families to help them get through these situations.
Nobody leaves here alone. For me, again, it's a blessing, and I couldn't do this anywhere else.